Meet Dr. Alex from New Haven Hearing Center in Connecticut. In today's fascinating case, he treated a patient with an extremely narrow ear canal, one that was almost completely blocked by a large solid chunk of earwax. Dr. Alex began with standard microsuction, carefully removing dead skin and surface debris. But when he tried to extract the main wax mass, it became clear that it was too large to fit through the opening of the canal. It was like trying to pull a baseball through a garden hose. At this point, he brought in a less commonly used tool, a Formby scoop. It's a metal instrument with a wide oval loop on one end and a blunt pick on the other. While he rarely uses it, this tool was perfect for gently dislodging the wax without damaging the delicate canal walls. After some precise loosening and positioning with the scoop, he returned to suction. But even then, the wax jammed at the entrance. So once again, he used the Formby scoop, this time to quickly and efficiently scoop out large portions of the blockage. Why not use a Jobson horn or St. Bart's hook? According to Dr. Alex, while those tools are effective, the Formby scoop moves more material in less time, ideal for large, surface-level debris. The result? A clean, healthy-looking eardrum and about 2 centimeters of tightly packed wax, removed mostly dead skin. A side-by-side comparison showed the scoop is just slightly larger than the Jobson horn, but far more efficient in specific cases. Sometimes, the right tool really does make all the difference. So let's take a look at this case now. And just a small request, please subscribe to the channel so I can keep bringing you more videos.